Hi, this is Lala from Brigham and Women's Hospital as a heart failure fellow. I have the distinct pleasure and honor of interviewing Dr. Douglas Mann from Washington University today. We've just come out of the late-breaking clinical trials in heart failure. Dr. Mann, thank you so much for agreeing to speak with the fellows in training. We were wondering, based on you just served as a panelist for the late-breaking clinical trials in heart failure, we were wondering what you were most struck by.
So, Anu, one, thanks for allowing me to address the fellows. I think there were really three trials that caught my interest. The one that I think has the most potential benefit going forward was the STOP-HF trial, where they used a BNP screening strategy in primary prevention of heart failure. We spend a ton of money treating heart failure once it's developed. If you think about it, if we could actually prevent it from developing, it might be much more economically feasible. So the STOP-HF trial used a BNP guided strategy, and they weren't specific about the therapies that they used, but overall it did reduce cardiovascular endpoints and did reduce evidence of structural damage to the heart measured as diastolic dysfunction and a decrease in EF. So of the three, first of all, it was the one that was most positive, but I think had the most utility going forward to help us to take care of patients with heart failure.
Thank you so much. Dr. Mann, in terms of advice that you give to your fellows, what would you say is sort of something to keep in mind at the forefront while we're undergoing our training, we're trying to look for jobs as we move on to the young faculty position? What is one piece of advice you would try and give us?
Yeah, it is a loaded question. So there are a lot of negative people out there about the future of cardiology and the future of medicine. I think the career that you've chosen is absolutely fantastic. I've been doing this for 30 years. It gets funner and funner each year. I think the most important thing I tell our fellows is do what gets you out of bed in the morning. Follow your passions. Do what you want. If somebody tells you that this area is oversubscribed and there aren't jobs, I think you should still do what you want to do, because at the end of the day, you will find a job, I promise you. There's a real shortage of cardiovascular physicians who are talented and trained the way that you people are, and I do think you're going to have a great career. It's just these are difficult times, but we'll get through them. We'll get through them, and you will have a job, I promise.